Thank you for giving us this unique opportunity to influence how the Board of Directors and the CEO plan to cater for Aboriginal and Torres Strait Islander peoples now and into the future. We will cover the following topics. The first topic is holistic care and the barriers that prevent the current mainstream health system from meeting the holistic needs of the Aboriginal and Torres Strait Islander peoples, and this will be presented by myself. The second topic is Aboriginal community controlled health services and their strengths in response to holistic health needs. This will be presented by Louisa. The third topic is interdisciplinary collaboration, especially the role of Aboriginal and Torres Strait Islander health workers and what their strengths and limitations are when they bring them to the interdisciplinary team. This will be presented by Shanti. The fourth topic is discharge against medical advice and the common health system factors that contribute to Aboriginal and Torres Strait Islander people's rates of discharge against medical advice. This will be presented by Rex. The fifth topic is political imperative of wellbeing and how patient advocacy by nurses contributes to improved health outcomes but has also been shown to be inadequate. And this will be presented by Andy.
Holistic care is a comprehensive model of care which is based on the philosophy of holism, that a person's physical, emotional and spiritual needs must be addressed for care to be considered holistic. The holistic approach to healthcare also emphasises uniqueness in the development process of a treatment plan, which corroborates the Aboriginal definition of health. According to the National Aboriginal Community Controlled Health Organisation, Aboriginal health means not just the physical well-being of an individual, but refers to the social, emotional and cultural well-being of the whole community, in which each individual is able to achieve their full potential as a human being, thereby bringing the total well-being of their community. It is a whole life view and includes the cyclical concept of life, death, life. When comparing this Aboriginal definition of health with a more general definition of health, it is beyond a doubt that this causes barriers for healthcare systems who currently mould their care to address the general definition of health. Other main barriers that prevent our current health mainstream system from meeting the holistic health of the Aboriginal and Torres Strait Islander peoples include lack of funding for educational ventures, health practitioners' cultural knowledge and ability to self-reflect, health practitioners' access to education, lack of Aboriginal and Torres Strait Islander healthcare workers, and lack of catered care. Firstly, the World Health Organization suggests that in order for health practitioners to perform quality, safe, ethical work, they must continually be educated. Thus, the Australian Government Department of Health has revealed that there are current limitations on educational investments for nurses within Australia, creating a barrier for those health workers in providing relevant evidence-based practice. Furthermore, the Australian Health Ministers Advisory Council revealed that 30% of Aboriginal and Torres Strait Islander people needed to, but didn't go to a healthcare provider in the last 12 months. This problem can only be addressed by healthcare workers performing cultural, safe and respectful practice, which can be achieved through effective education and self-reflection. Moreover, the population of Indigenous people in Australian healthcare workforce continues to be a barrier, as the largest occupational gap between Indigenous and non-Indigenous Australians in 2011 was in healthcare. And the NACCHO has stated that only local Aboriginals controlling healthcare will address this issue. Finally, Aboriginal community-controlled health services like the NACCHO provide specific services to local communities and tribes that cater to their current health needs and priorities. As current mainstream health services don't provide these services for their local Aboriginal communities, this is a barrier for the institutes and staff in providing the Indigenous individuals with holistic care.
Aboriginal Community-Controlled Health Services, ACCHS, exist all over Australia, and as of 2018 there are more than 150 ACCHSs across Australia. I'm here to present to you the benefits and strengths that Aboriginal Community-Controlled Health Services provide in response to Aboriginal and Torres Strait Islander holistic health needs as defined by Ashley earlier. In summary, NACCHO's definition of health includes key terms such as community, human being, social, emotional, and cultural well-being and full potential. And what I can confidently say is that Aboriginal Community-Controlled Health Services adapts and encompasses all these terms. Firstly, considering the holistic approach of person-centred care as the concept and practice of cultural safety, the community and rich history of the Indigenous people is what needs to be considered when providing them health care. When the whole patient and their story is just a disease or a waiting room number in a big city, the people do not feel like human beings and do not feel part of a community. However, ACCHSs like Calvin Developmental Corporation Ltd is one of those ACCHSs changing lives. Firstly, this support service is community managed and governed by elected Aboriginal and Torres Strait Islander directors and one independent director. Therefore, a sense of community belonging and cultural well-being is already established and maintained. Calvin spread their services across the Gold Coast and Brisbane. Furthermore, the existence of these ACCHSs always paid tribute and respect to the original inhabitants of the area. For example, Colwyn is derived from the Aboriginal name for the rainforest lyre bird, a bird of great significance to the original tribe. Secondly, access barriers have been minimised through the transport and funding services that the ACCHSs provide for the Indigenous Australian community to see specialists or general doctors with consideration to their individual circumstances. It has also been reported that due to ACCHS services, coverage of the Aboriginal population is now higher than 60% outside major metropolitan areas. Furthermore, many tribes prefer the use of traditional medicine over Western medicine. This is not only culturally safe practice that incorporates and respects Aboriginal and Torres Strait Islander people's history, but beyond a doubt have positive impacts. The first Aboriginal controlled health service opened in Queensland, Brisbane, and increased patient visits to doctors from around 9,000 to more than 18,000 visits in just 2 years. This is evidence that Indigenous people are more willing to utilise ACCHS services if available and lead to consistently higher performance than mainstream general practices. Without question, Aboriginal and community-controlled health services reduce barriers to access, unintentional racism, and cultural differences. Lastly, and most importantly, there has always been a lack of Indigenous Australian nurses, which have further contributed to the racism felt by Aboriginal and Torres Strait Islander patients and healthcare workers. However, ACCHSs have played and continue to play a significant role in the training of medical workforce and recruiting Aboriginal people.
Good day. Today I'll be talking about the Aboriginal and Torres Strait Islander health worker. They are ethnically or racially Aboriginal or Torres Strait Islander people. The Aboriginal and Torres Strait Islander healthcare worker is one of the most important healthcare workers in the Aboriginal healthcare community. Healthcare centres in the rural areas do not provide many services, but healthcare workers usually assigned at the location. The healthcare worker are qualified and skilled health professionals that provide direct care to the Aboriginal patients. They provide a wide range of healthcare for the community while taking care of the emotional, cultural, social well-being and physical health. They specialize in drug and alcohol treatment, diabetes, sexual wellness, mental health and treatment, and ear and eye health. Their skill to provide a wide range of care is considered an essential supplement to conventional health services. They know the community well and which families are in need of support as they are part of the local community themselves too. The Aboriginal and Torres Strait Islander health workers also play an important role in planning of admission and discharge of rural patients to urban hospitals. They provide culturally safe practice while helping create a friendly and relaxing atmosphere for the Indigenous patients as they are from the same community. This is due to them having the knowledge, awareness and skills to handle cultural factors while providing adequate health services. Problems can sometimes occur as the Aboriginal and Torres Strait Islander health worker has to balance community obligations while mainstream healthcare requirements. This problem arises due to cultural demands and community needs being high. This can lead to a lack of clarity in their role of clinical or support role as they feel bonded to all Aboriginal people. The Aboriginal and Torres Strait Islander health workers are often treated as instruments for engaging with Indigenous people. It is of great benefit when care is provided by a specialist nurse and a health worker that is of the same socio-economic and ethnical background as the patient. Using this method, both provide an expertise that they cannot on their own. This collaborative model was created to address the issue of cultural safety while having an Aboriginal person involved in all stages of healthcare. This method was proven to be successful as there has been an increase in attendance of indigenous people in the healthcare centers. Overall, I can state the Aboriginal and Torres Strait Islander health worker is a fundamental part of the healthcare provided for indigenous people who provide cultural safety and a wide range of health services for indigenous people while creating a welcoming environment for all the indigenous patients.
Good morning. I'm going to present to you my findings on discharge against medical advice among Aboriginal people. First of all, discharge against medical advice means patient leave the hospital without authorization. Discharge against medical advice usually increases the rate of readmission, mortality, morbidity, and burden to the healthcare system. Research found that Aboriginal people have higher rates of discharge against medical advice because of health inequality. Racism and socio-economic disparity are the two main factors which leading to health inequality between Aboriginal and non-Aboriginal people. More than 50% of Aboriginal people interviewed reported that they have experienced racism while accessing to the healthcare system. Racism, including but not limited to policies and or personal behavior which advantage or disadvantage one group of people over another. It will lead to an unpleasant experience to the patient and causing a higher rate of discharge against medical advice. Socio-economic disparity, on the other hand, means the differences in social status, such as wealth, power, and education background. For example, research shows that more than 90% of patients rely on social welfare on insurance policy while accessing to the healthcare system. Aboriginal people usually have lower social welfare status or insurance policy than non-Aboriginal people, which increases their opportunity cost to attend to the healthcare system and incentive to leave the hospital while at care. In addition, educational background is one of the reasons leading to discharge against medical advice. Patients who discharge against medical advice usually do not understand the treatment due to insufficient knowledge and miscommunication. It is important for healthcare professionals to resolve the health inequality and lower the rate of discharge against medical advice. Cultural safety is important in diminishing health inequalities and lower the rate of discharge against medical advice. For example, Aboriginal Health Liaison Officer, who is an Aboriginal health professional and helps the indigenous patient to interact with hospital and support non-indigenous staff to understand the Aboriginal culture while their knowledge and cultural background. Non-Aboriginal staff can identify with and resolve the needs of the Aboriginal patient more directly and easily. Healthcare facilities with Aboriginal Health Liaison Officer has a lower rate of discharge against medical advice. Therefore, in order to lower the rate of discharge against medical advice, culturally safe care is an important area for healthcare professionals to focus on.
The Indigenous Australians have long been marginalised in the country. There is convincing evidence of the enormous social and economic disparities experienced by the Aboriginal and Torres Strait Islander peoples has led to an increase in morbidity and mortality. Likewise, the influence of racism in hindering the access of quality healthcare services by the Aboriginal and Torres Strait Islander peoples. Patients' advocacy, on the other hand, is a vital part of the nursing profession and is seen to be an invaluable attribute which makes the nurse an ambassador of goodwill to the patient. A patient advocates and advocates for client's rights. In that role, the nurse protects the client's human and legal rights and aids in asserting those rights if the need arises. The quality of being a patient advocate is incorporated into nursing school faculties and reflected through the professional code of conduct across the various healthcare parastatals and organizational boards across the world. Nonetheless, the concept of racism, prejudice, power differential, and other negative attitudes such as discrimination, biased assumptions, misconception towards Indigenous Australians can hinder the propagation of patient advocacy in nursing and healthcare system in general. This is an indicative reflection of the Australian history, still tenacious in the mainstream of contemporary society. Therefore, the application of cultural safety in nursing can immensely help to curtail the impact of racism on the access to quality healthcare services by the Aboriginal and Torres Strait Islander peoples. The concept of cultural safety enables a person to better understand him or herself culturally and otherwise, the power dynamics and differentials in nursing profession, the healthcare system in a broad sense. Also, it makes the individual to be perceptive to the underlying structures, procedures, and systems that affect the clients. How can nurses be patient advocates? Nurses can be patient advocates by identifying when there's inadequate resources to meet the client's need, protecting the rights of their clients and easing informed decisions, pinpointing policies and practices which transpasses patients' rights, clarifying with those guidelines, policies, and practices when patients' rights are encroached, and finally to recommend changes to those policies, procedures, and guidelines. In conclusion, it is true advocacy that nurses can cater and meet the requirements of their patients individually or collectively. Also, patient advocacy in nursing is not fully complete without the inclusion and application of cultural safety. Thank you for your time.